First off, I want to thank Amy and Fanta Dental for giving me this opportunity to share my thoughts and insights on the Fanta Dental Rising file system that I'm really fond of, and how you can use it on your daily endodontics. So, thank you very much, Fanta Dental, for the invitation. I would also like to thank the local distributor of Fanta Dental in Greece, Floros Dental, for bringing us into contact and for supplying me with the Rising file system, which is, as I said, a very, very consistent file system in modern endodontics. So I'm Nikolaos Tzimas, and let's start off with a few things about myself. I am from Greece, and I was born and raised in Veria, Greece, which is a really nice little town, around 50,000 inhabitants, located in the north part of Greece. It's a very safe place, and it's a great place to raise a family. So I consider myself very lucky to have been brought up in Veria. Apart from the fact that it's called the Little Jerusalem because it has over 40 Byzantine era churches that are still present, our biggest flex is the fact that the Aegeis, very, very close to Veria, was the place of coronation of Alexander the Great. Now, everyone knows Alexander the Great. But if you know that a few of our international audience know that the tomb of Alexander the Great's father is located in Vergina, right next to Veria. And you see, this is the crown that they used to wear back in 336 BC with the acorns and the oat leaves. And this belonged to Philip II, the Macedonian king. So right after my graduation from high school, I moved to Slovakia, and especially to Bratislava. This is the capital city of Slovakia. Fun fact is Vienna and Bratislava are the closest capitals in the world, only separated by 65 kilometers. So in Bratislava, I obtained my DDS back in 2014 from the Comenius University, which is the biggest university in the whole of Slovak Republic. And then I moved back to Greece. I had to do my mandatory military service. I worked as a dentist in the military. Then I worked as a general dentist. And in 2022, my dream came true because I was only thinking endodontics. I obtained my Master of Science in Endo in 2022 in the beautiful city of Thessaloniki from the Aristotle University of Thessaloniki, which is also the biggest university in Greece. And one of the two universities in Greece that offer a full-time clinical Master of Science in Endodontics. So I still live in Thessaloniki, Greece. Thessaloniki is the second largest city in Greece. It's located in the north. You see, it's very close to my hometown in Veria. And I work as an endodontist in various multidisciplinary practices around town, exclusively performing endodontics under the microscope. So this is what I'm doing up until now. My next project is going to be a microscope and CBCT specialty practice located at the southeastern suburb of Thermi in Thessaloniki, Greece, hopefully opening up in September 2026 and getting our first referrals. So let's do an educational framing of the whole webinar. This is a presentation preferred for the Rising file system. Any related comments should be interpreted with caution and along with the official instructions for use. As always, my clinical message is protocol first. We will talk about the access and working length before proceeding to the mechanical preparation part of the presentation. And my goal today is to showcase how a sequence can become predictable when it is used correctly. So we all dread such cases as this one. I mean, it's necrotic. You you may suspect of a double curve. Uh, you don't know how calcified it is or it isn't. But the reason I wanted to share my thoughts on the Rising file system is that it makes it so easy. This is a case from this week, and it got complete in under an hour. And one of the perks of using the Fanta Rising file system is the fact that it gives you time to do the irrigation properly. And as we will see on some next cases, it gives you also time to do a difficult restoration and not bother with how to do the endo. So in daily endodontics, all we need is speed, predictability, and safety, and always obtain consistent results. Let's see what we are going to talk about today. I always view mechanical preparation as one with the access cavity and working length. So I will share some info about the access cavity and the working length first, and then proceed to the bigger part of the presentation, that being mechanical preparation. And when it comes to mechanical preparation, we will do a full file-by-file breakdown of the Fanta Rising file system. I will share with you guys some clinical tips on the file use, and I will share some clinical protocols according to case difficulty. That being said, it's going to be a case-based learning, the final part, where I will share a little bit more than half a dozen of my cases with the Fanta Rising file system. So let's start off with the access cavity preparation. Shortly, the number one landmark article, if you want to talk about the basics of access cavity preparation, is The Anatomy of Pulp Chamber Floor by Paul Krasner and Henry Ranko back in 2004. So they did a huge study, and they shared some of their findings, which can help you navigate through the access cavity preparation. First off, the pulp chamber position at the level of the cemento-enamel junction. The walls of the pulp chamber are central, and the pulp chamber position is central and equidistant to the root canal, to the root walls. The pulp chamber floor has darker dentin, and this darker dentin helps us differentiate from the chamber walls and the reparative dentin. And there's the location of the canal orifices, which are located at the floor wall junctions or the angles of the floor wall junctions, or at the end of the developmental root fusion lines. And then they gave us two laws of symmetry. The law of symmetry number one, which describes the fact that if we draw a mesiodistal line, as you see on the lower left picture, the canal orifices are equidistant from that line. And the law of symmetry number two, now on the same mesiodistal line, if you draw a line from one orifice to another, then it falls perpendicularly 90-degree angle on this mesiodistal line. Now, the law of symmetry number one and the law of symmetry number two applies to all teeth in the permanent human dentition, with one big exception, that being the maxillary molars. So in the new age of access cavity preparation, which new age started in 2010 with the now landmark article by David Clark and John Cademy, the authors considered very important the concept of the pericervical dentin, which is defined as a critical zone extending 4 millimeters coronal to the crestal bone and 4 millimeters apical to the crestal bone. And it's the authors consider it crucial for transferring load from the occlusal table to the root. So the access designs started becoming more conservative. where they started sparing the pulp corns. So this article, in addition to the boom of the social media dentistry during the 2010s, led the European Society of Endodontology issue two articles, one in 2020, one in 2022, regarding the minimal access, endodontic access cavities. So on this article on 2020, the authors propose a very thorough and well thought of classification. And the conclusion is that you can use conservative access cavities as long without affecting your clinical procedures, as long as you use a microscope, as long as you have a CBCT scan of the case, and as long as you have flexible files. And flexible files is all that we're going to see during the next parts of our presentation. Very shortly, through 2 or 3 slides on working length determination. You can do an initial estimate of your working length from the periapical radiograph, or you can use an electronic apex locator. Additionally, you can use an electronic apex locator to determine and confirm your working length. So there are some things that the electronic apex locators can, and some things that they can't do. So on the things that they can do, they can show you where the apical foramen is. And this has been shown quite vividly by this picture from Gustavo Dedeu's publication. Plus, modern apex locators, they are not influenced by the presence of irrigants or pulp tissue remnants. And the readings of the electronic apex locator are not affected. On the contrary, we should be very cautious when we want to find the apical constrictions. Apex locators, no apex locator can show you the apical constriction. You need to be cautious when used in patients with pacemakers, and you will get erratic readings when the apex locator is used in open apices. So now that we got the first part over, let's go to the core of our presentation, which is the Rising file system. We will do first a file-by-file breakdown. Then I will share some clinical tips on the file use. We'll see 2 videos, and then we will go case by case, and according to the case difficulty, we will see some clinical protocols. So the Fanta Rising file system, it's essentially controlled memory treated night-eye with different phases in its file. As you can see from the color, there's different on the first file, different file phase, night-eye phase on the first file, and different night-eye phase on the last file. They have a variable cross-section, but they have a fixed taper. And this makes the cutting angles to facilitate cutting efficiency. So they cut very sweet. They are very smooth on cutting, and you get the maximum debris removal to the coronal, so as not to pack debris and cause postoperative pain on the apical. So it's a 5-file system. The speed it works is 450 RPMs, and the torque is set at 2.5 Newton centimeters of torque. All of the files work the same speed and the same torque. What is different from any other system in the market today is the fact that the last file is not always the last file. It can be used after the 2504 or after the 3004, as we will see over the next couple of minutes. So the RR is it's an orifice shaper. It has apical diameter of 17 and 10% taper. It has a semi-active tip, which means what you're thinking. It can and will remove gutta percha, so you can partially use it even for some retreatments. But apart from the retreatment thing, why use the RR file? The RR file is very important to use during your preparation with the Fanta Rising file system because it will remove coronal interferences and will improve working length accuracy. Actually, working length by means of an electronic apex locator should be measured after using the RR. It will also give you an easier and safer glide path on your glide path file, and it will help to the preservation of the original canal anatomy, which in the era of conservative dentistry and especially conservative endodontics is of utmost importance. So every time I have the Fanta Rising file system at hand, the first thing I do is I get a fresh new one out of the packet. And this is the first thing I do after the access cavity preparation. I do the orifice shaping because only then I can go measure my working length and have my working length determination safe. And I can use the next file, the R1, to do my glide path. So the R1 is the glide path file of the system. It's 13 at the tip with an 03 taper, so it's quite slim. It has a gold-specific wire, and it's pre-bendable. That means that the night eye phase is martensitic in room temperature. That is very important because if you have limited mouth opening, or if you have a preparation that is an access cavity preparation that is very conservative, you can pre-bend it and make your way around easier. But other than that, how will you benefit from using the R1 file? So the R1 file will reduce the torsional stress and the taper lock on your future files, on the files that you are going to use after the R1 files, because it will create the glide path. So it also reduces the debris extrusion, which is in some cases and in some studies linked to postoperative pain. It will certainly reduce your treatment time other than going with your hand files and trying to create a manual glide path. And it will make procedural errors less likely. As I said, you have the glide path. So the next files will follow this path, and it will make procedural errors highly unlikely. I will say not only less likely, but highly unlikely, especially if you are using the Fanta Rising file system. So the R1 is my favorite file on the file system of Rising because it's a heavy-duty file and it's the workhorse. I never consider doing a challenging canal without using the R1 file. There are some cases and there are protocols where you can omit the use of R1 as shown by the later instructions for use I will share with you. But to me, it's my favorite file. It makes everything so much easier. The R2 is a 25 at the tip and with an 04 taper. It can be used as the last file, and it has a unique apical design in order to get optimal gutta percha cone fit, especially if you're using the rising gutta percha cones, which will make your life so much easier on everyday endo. The R3 has a gold wire. It's a 3004 file, and it can be used as the last file. But the R4, my heart goes to R4 from the Fanta Rising file system It's a 2805. It has a slightly bit of a bigger taper, but not that big apically. It's called the passage file because, as I said, you can use it after the last file, even after R2 or after R3. And this is more flexible than the R3, which makes it my number two personal favorite after the R1 file. You should not forget that you can use matching paper points and gutta percha combs to make your life easier, faster, and predictable because they work so perfectly with the shapes that the Rising file system prepares. So we got the file by file breakdown from the beginning, and let's do some clinical tips on file use. So a few tips. The pecking motions that you do with your endomotor should be 1 to 2 millimeters in amplitude. The apical pressure is always gentle. You should not force or press the instrument inside the canal. It will work, but you have to trust the process. And the irrigant should be always inside the canal. It should be flooded with irrigant to reduce the torsional stresses. So in most canals, you can use 2 or 3 strokes, and then you do the inspection and fluid cleaning, preferably with a sterile gauze and alcohol. Or in severe curvatures or calcifications, you can do the so-called single stroke and clean, where you only insert one time. So let's do the video of the 2 or 3 strokes. We go on the MD1 right here. It's a slowed down video. So 1 and 2 and 3, and off we go. All right. So the next is the single stroke and clean on the same tooth, on the same case. We will see, I will share the case later in the presentation. And we go in and 1, and off we go. Inspect, cleaning with a sterile gauze and alcohol. And we go to the final part, where it's the clinical protocols according to the case difficulty. There are 4 protocols that you can follow. One is for easy canals, where you go up, where you take all the sequence up until the R2. Then is the single file technique, where you omit the use of the R1. As I aforementioned, you can omit the use of R1 in large canals and use a single file technique. You have the moderate canals, where you use the passage file straight after the R2. And you have the extreme anatomy and large canal protocol, where you use the whole sequence of files. So let me share some easy cases with you. Here we have pulp necrosis of the 1-4. This is a perioendo case because you see the crown is intact. There is no caries. So I opted for a minimally invasive access cavity preparation. I tried to keep it as small as possible and as small as convenient. And with the easy cases sequence of the RR, then using a C file number 10 to obtain the working length, R1 and R2, I was over in less than 5 minutes. But then the whole case, because I needed to irrigate, took me almost 40 minutes to irrigate thoroughly. So this is one advantage of the Rising file system. It makes the prep easier so that you have time to irrigate, and you have time to do the final restoration on the same visit. So this was over in like 45 minutes, and I consider the file system that I use um, the one that made the difference. So single technique, single file technique can be used in quite wide canals, like let's say maxillary anteriors or maxillary incisors. You can omit the use of the R1 in such cases. For moderate cases, you can use the R4 after the R2, that being a 2805 after the 2504. Let's see some moderate cases now. This is the 1-4, even though apical the apical radiolucency is not yet fully visible on the periapical radiograph. This is a pulp necrosis case of the 1-4. Again, I did the moderate cases protocol. Very, very easy. I saved my time, saved a lot of time for the irrigation and activation of the irrigation, and then proceeded to obturate with the matching Fanta Rising system gutta-percha cones and calcium silicate sealer of choice. This is a 3-6 with a pulp necrosis again. You see, it's necrotic. So I did the moderate cases protocol, 4 canals, mesial and distal joining on the apex. Then we have on February, this is the final shot of the obturation. And the patient came again in April, where I told him, I know it's kind of early, but let's do a quick X-ray and see how is it going. So it's going very well. It's going very well. It's starting to heal. The radiolucency is starting to get better. So again, I used the matching gutta-percha cones on this case with calcium silicate sealer. And most of the cases that I'll share with you guys today are extreme cases and large canals because if you remember, I work as an endodontist, so I always get the hard ones. They always give you the hard ones when you're an endodontist. So this first case, you saw the video earlier. This is a 2-6 with a symptomatic irreversible pulpitis. And there's a big amalgam filling. This is the initial radiograph of the case. I see a curvature on the mesial file systems, and I don't know whether there's a curve or a slight curve on the distal. So I used the 2504 for the mesial and distal root canal systems, MB1, MB2, and D. And then I used the 2805 after using the 3004 on the palatal root canal. So I also tried to to be as conservative as possible with my access cavity preparation, and I proceeded to obturate with matching gutta-percha cones from the Fanta Rising system, along with calcium silicate sealer. And this is the final X-ray. And of course, the Rising file system gives you time to do things. So I had time to also do the permanent restoration. And look how beautifully it went in almost an hour. We were over and done with. So this patient was referred with a symptomatic irreversible pulpitis on the 46. What you see there is a caries lesion with a temporary filling. So in this case, I wanted to go to 2805 on all canals using the 3004 to mitigate the torsional stresses because I saw that there is a double curve on the distal. I also did another thing. I tried to be as conservative as possible on my access cavity. So I opted for a case-directed access cavity preparation. Here you see we have two canals on the mesial and one canal at the distal. And this is the final shot of the case with obturation as well as restoration. Um, Again, saved me so much time that I had time for demanding restoration like this. This is 1-6 with the symptomatic reversible pulpitis and symptomatic apical periodontitis. As you see from the photo, I always try to do directed access, save as much tooth structure as possible. Here we had a restoration on the 1-6. So I removed the restoration and I tried to spare as much dentin as possible. Of course, the Rising file system had no problem navigating even in conservative access cavity preparations, even in extreme angles. I used the 3004 on the mesials and distals, and I used the 2805 as the last file on the palatal. I obturated with the matching gutta percha cones and the calcium silicate sealer. So this is the final shot of the case. And please take note of the difficulty that I had to overcome, that being the conservative access cavity doesn't always give you space to 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 do the filling so that it covers also the pulp horn. But with the Rising file system, I got the endo over in a bit, and then I could concentrate on doing my restoration as I should be doing my restoration, with no voids and without any overhanging fillings. This is a truly extreme case. This is 1-6 with the symptomatic irreversible pulpitis. It has a big amalgam filling. You see that the calcification is evident on the pulp chamber as well as on the root canals. So after removing all the silver filling and the caries, I ended up with this access cavity, and I used strictly a 2504 on the mesial and distal, as well as a 2805 on the palatal. Here we have double curves, we have extreme curves, which were not visible, but were only visible post-obturation. Can you see the MB2 on the right radiograph? It's almost more than 90 degrees. But then again, the Fanta Rising file system, it had no problem navigating through those canals. And on the distal, as you can see, there is a double curve, and actually the curve is on the apical. I mean, the system, it didn't even flinch. It went smooth. So it gave me time to clean the tooth properly and then put the temporary filling on, do the space for the post or the dowel, and send it off to my referral. And this is the last case. This is a 3-6, which was vital and was previously initiated as a first aid. In this case, I used the 3004 as the final file for the mesials and the 2805 for the two distal canals that were joining. Of course, I used the gutta percha matching cones. And this is the photo of the final obturation of the root canal. I mean, my point here is that if you see the final radiograph, you will see a very large canal on the distal. But you see that on the apical part, the matching gutta percha cone is holding the fort. I mean, I did the warm vertical compaction here with the calcium silicate sealer, but the shapes were so good, and the fit of the gutta percha was so good that we had no sealer extrusion whatsoever. And here is the final photo of the restoration by my good colleague that did the final restoration and kindly gave us this photo. So to conclude, some take-home messages from today's presentation. The Rising file system is optimal. It's actually, in my humble opinion, it's one of the best systems, if not the best system, to get started with in endodontics for new users. Experienced users will have no problem using it, but new users will find it very, very easy to navigate through endodontics for the first time with a file system if they're using the Rising file system. And that is because of the 04 tapers, or at most 05 taper. They don't have the tendency, the files, they don't have the tendency to drag you inside the canal. So the new users will benefit from it as they cut smoothly and very controllably. It is fast, it is reliable, and it is predictable, and it gets even more if you use the matching paper and gutta percha cones on this system. It is safe to use, as you saw from my cases. It is safe to use in straightforward like anatomy, but it will handle aberrant and extreme anatomy with so much ease you wouldn't believe it. And 95% of your non-surgical root canal treatments can be completed with the use of the Rising file system. So that is all for today. Thank you so very much. I send you my greetings from sunny Thessaloniki, Greece, or I send you my good nights, whether you are seeing us from overseas or from Asia. Thank you so very much for this opportunity to share my insights on the Rising file system. Thank you, Fanta Dental. And please keep in touch. And Endoconspiracy is my work page where I share my cases and I share my work or maybe some strange cases that I find. And Thermi Endodontics is the newly launched page. It's still under construction, not so many followers, but it's going to be the page of my personal specialty practice in Thermi Thessaloniki, Greece. So once again, thank you, and you have a good day from Thessaloniki, Greece.
Okay, thank you. So today's webinar comes to an end here. Thank you so much for Dr. Nikolaos for giving us the wonderful course. And thank you all, and looking forward to your next participation. And if you have any questions, you can directly message to the speaker and also leave a message to our official account. Thank you.